If you're over 60 and you've been told your blood sugar is a little high, I want you to pay close attention for the next few minutes, because there's something most doctors don't have time to explain in a 15-minute appointment, something about 5 ordinary fruits sitting in your grocery store right now that could quietly be working against you or working for you, depending on how you eat them. I'm a physician. I've spent years sitting across from patients just like you, people who did everything right on paper, cut out the cake, skipped the soda, and still watched their fasting glucose numbers creep up year after year. And almost every time, the conversation eventually turns to fruit. Because so many of my patients over 60 have quietly stopped eating fruit altogether. They're scared of it. Someone told them fruit is just sugar, and so an apple started feeling as dangerous as a candy bar. I want to gently correct that idea today, not with hype, not with miracle promises, but with what I actually tell my own patients in the exam room. By the end of this video, you'll know 5 specific fruits that, when eaten the right way, tend to have a gentler effect on blood sugar than people assume. And just as importantly, you'll understand why the fruit itself usually isn't the real problem. Stay with me, because the third fruit on this list surprises almost everyone I mention it to, including some of my own colleagues. Let's start with a story. I want to tell you about a patient I'll call Linda. That's not her real name, but her story is a composite of what I see often enough to call it typical. Linda was 68, retired school teacher. She came into my office frustrated. Her fasting glucose had been sitting stubbornly in the pre-diabetic range for almost 2 years. She told me almost apologetically, "Doctor, I don't even eat fruit anymore." I figured that was the smart thing to do. We talked it through. It turned out Linda had cut out fruit entirely, but she was still having orange juice most mornings because juice felt healthy, night chew and a granola bar most afternoons. Here's the thing I had to explain to her, and I want to explain it to you too. Whole fruit and fruit juice are almost 2 different foods when it comes to blood sugar. When you eat a whole fruit, you're getting the natural sugar packaged together with fiber, water, and structure that your body has to work to break down. When you drink juice, that fiber and structure is gone. You're left with fast sugar hitting your bloodstream all at once. Linda didn't need to fear fruit. She needed to understand which fruits and how to eat them. Over the following months, with her doctor's guidance, she swapped her orange juice for whole fruit, adjusted a few other habits, and her numbers gradually, not miraculously, gradually moved in the right direction. I share her story only as an illustration of principles, not a promise of what will happen for you. Everyone's body, medications, and health history are different. Now let's get into the fruits themselves. Fruit 1, berries, the fiber powerhouses. Think of fiber as a kind of traffic cop for your bloodstream. Without it, sugar molecules rush through all at once, like cars flooding an intersection with no signal. Fiber slows that rush down, spreading the sugar's entry into your blood over a longer period so you don't get that sharp spike. Berries, strawberries, blueberries, raspberries, blackberries are among the lowest sugar, highest fiber fruits you can eat. My patients often tell me they assumed berries would be too sugary because they taste sweet, but sweetness isn't the same as sugar content. A cup of strawberries has a surprisingly modest amount of natural sugar wrapped in a generous amount of fiber and water. In my practice, I often suggest berries as a topping, on plain yogurt, on oatmeal, or simply on their own as a snack, rather than turning them into smoothies, which strip away some of that fiber structure when blended for a long time. Fruit 2, apples, but with the peel on. I've seen this many times. Patients peel their apples thinking they're doing something healthier. It's actually the opposite. Most of an apple's fiber sits in and just beneath the peel. Peeling it is like removing the traffic cop and letting the sugar rush straight through. Apples also contain a specific type of soluble fiber called pectin, which forms a kind of gel in your digestive tract, slowing sugar absorption even further. Pair a sliced apple with a small handful of nuts or a spoon of nut butter, and you slow things down even more, because protein and healthy fat also blunt how fast sugar hits your bloodstream. Fruit 3, pears, the one that surprises people. This is the one I mentioned earlier. When patients think of diabetes-friendly fruit, pears rarely come to mind. But pears are one of the higher fiber fruits available, and like apples, most of that fiber lives close to the skin. I remember a patient telling me, "Doctor, pears always felt like a dessert fruit to me, too sweet to be good for my sugar." But sweetness, again, is deceptive. Pears release their natural sugars slowly, largely because of that fiber content. A ripe pear, eaten whole, skin and all, tends to be gentler on blood sugar than its taste would suggest. Fruit 4, cherries, small but mighty. Cherries, particularly the tart varieties, sit relatively low on what's called the glycemic index, a rough measure of how quickly a food raises blood sugar. Think of the glycemic index like a hill. Some foods are steep hills, sugar climbs fast, then crashes. Other foods are gentle, gradual slopes. Cherries lean toward that gentler slope. Portion still matters here. A small bowl of fresh cherries makes a satisfying snack. A large bowl, eaten quickly, is a different story. Even gentle slopes get steep if you sprint up them. Fruit 5, citrus, oranges and grapefruit, eaten whole. I want to be careful here because citrus is a good example of it depends how you eat it. A whole orange, segmented and eaten as is, comes with fiber and takes time to chew and digest, both of which slow sugar absorption. That same orange, juiced, loses most of that protective fiber and concentrates the sugar from multiple oranges into a single glass, sometimes without you realizing how much you're consuming. One important safety note on citrus, especially grapefruit: it's well known in medicine to interact with certain medications, including some used for cholesterol and blood pressure. If you take prescription medications, please check with your doctor or pharmacist before making grapefruit a regular part of your diet. This is exactly the kind of individual detail that a video like this can't account for, but your own doctor can. So here's the pattern underneath all 5 fruits. It's not really about which fruit has the fewest grams of sugar on a label. It's about fiber, portion size, and whether you're eating the fruit whole or in a processed form like juice. Whole fruit, eaten in a reasonable portion with its fiber intact, tends to be a far gentler experience for your blood sugar than most people over 60 have been led to believe. I'll be honest with you about the science here too. Research on fruit and blood sugar management is genuinely encouraging, but it's not a substitute for medical care. Diet is one piece of a much larger picture that includes your medications, your activity level, your sleep, your stress, and your individual health history. If you're on medication for diabetes or blood sugar, please don't change your diet dramatically, and never stop or adjust any medication without talking to your healthcare provider first. Fruit can be part of a smart plan. It isn't a replacement for medical guidance. A quick, honest question for you. I'd love to know, how old are you watching this today? And where are you tuning in from? I read the comments, and it genuinely shapes what I make next. And if you've ever cut fruit out of your diet because you were worried about your blood sugar, tell me about it below. You might be surprised how many people in the comments have done exactly the same thing. If this video is giving you something useful, a quick like helps more people your age find it. And if you're not already subscribed, it helps me keep making videos like this one for you. Tonight's action plan. Before we close, here are 5 simple things you can start tonight. 1. If you enjoy fruit juice, try swapping it for a piece of whole fruit at least a few times this week. 2. Leave the peel on your apples and pears when you can. That's where much of the fiber lives. 3. Pair fruit with a small amount of protein or healthy fat, like nuts or plain yogurt, to slow sugar absorption. 4. Keep portions reasonable, a small bowl, not an overflowing one. 5. If you're on any medication, especially for blood pressure, cholesterol, or diabetes, check with your doctor or pharmacist before making major dietary changes, particularly around grapefruit or citrus. And if you ever experience symptoms like sudden confusion, extreme thirst, rapid heartbeat, fainting, or anything that feels seriously wrong, don't wait. Seek emergency medical care right away. I know fear can make food feel like the enemy, but food, eaten with a little bit of knowledge, can become one of your steadiest allies as you get older. Linda didn't need to give up fruit. She needed to understand it a little better. And now, so do you. If you found this helpful, there's a video I made recently on a hidden habit that quietly raises blood sugar for people over 60 boss, one that has nothing to do with food at all. I think you're going to want to see it next. Take care of yourself. I'll see you in the next one.